professionals include team physicians, optometrists, ophthalmologists, athletic trainers, and sports physical therapists. Providing practice or game coverage must be familiar with sports-related ocular emergency protocol. So nakasama tayo dyan, no, in the book that I got, this sports medicine. Natuwa ako that they have recognized optometrists as part of the medical and allied health professionals that is included in sports medicine. That's why we have this discipline in optometry curriculum. We have this sports vision because we play a vital role in also identifying or in helping in our athletes, when they become our patients so that they will be protected. What are the emergency situations that we would consider, no, in when these sports injuries happen? So, an emergency situation would be if there are foreign objects in the eye causing eye pain. So, what are these foreign objects? It could be visible object, not embedded. It could be objects that are not visible, or it could be visible object that cannot be removed, possible penetration of the eye globe, blood seen in the eye, object possibly trapped behind upper eye, upper lid, vision problems, and other eye pain. So siguro dito as of personal experience that hindi naman atleta si Dr. Anda, pero one time papasok siya ng school. So along the corridor na sa CEU sa hallway sa labas naman parang mahangin. Tapos basta merong para siyang napuwing. Tapos pasok siya sa clinic, talagang sakit na sakit siya, natitiri siya, talagang na maintindihan yung ano niya, yung kanyang yung pain. May nagtaas ng kamay? Sino yon? Anything? Kamali lang. Okay na, I can proceed.
Okay na po ata, Dok.
Alright, sige. May tumunog kasi. Anyways, as I was saying, tapos talagang bother shots, wala naman kaming makita. Tapos at that time, meron tayong ophthalmologist. So, punta siya. Tapos tinignan siya. Tapos may nakita, it was under her eyelids, no, upper eyelid. Tapos kumuha ng cotton tip applicator yung doctor. Tapos talagang sinwipe niya, parang swipe or ni-scrub niya dun sa lid. Tapos grabe, ang sakit, nakita ko yun. Tapos pagtingin, parang may paa ng insect na hindi maintindihan na very small. But when it was removed, then Dr. Anda was able to feel comfortable already. So those are the things that can happen, no, when we are playing. Syempre, nasa field, di ba, no? So, very important that we're able to manage, or somehow give referral. And it's just that uh, the knowledge of it, no, kung awareness that we can create among our athletes so that they would be very willing, no, to really have those eye protectors that we can provide for them. Another emergency situation we have discussed earlier, this would be a supplementary or blunt trauma. So patients should have a dilated fundus examination within 96 hours of the event if there is a blunt trauma because serious internal eye injuries may have occurred. Apply cold compress for the first 24 hours unless one of the signs below is present, like lid swollen, irregular pupil shape, blood inside the eye, cornea is white or hazy, problems with vision like floaters, stars, and distortion. So very important, no? Sabi niya kailangan matignan siya ng ophthalmologist, let's say, for a dilated fundus examination because if there's a blunt trauma, so a big force, yung kanina 96 miles ba yun per hour na tatama sa mata mo. Imagine that, naalog yung mata mo. So, meron kang coup, counter coup, no? Effect ng ng trauma mo. So, you do not know kung paano nangyari sa loob ng mata mo. Naalog yan, merong nagkaroon ng depression or anything. So, very sensitive, syempre, no? Or even can be that baka meron kang naging bone fractures, so we have to have that eyes check. This one is burns. No, in the event of chemical burn, do not attempt to neutralize the acid or the alkali. Don't use an eye cap and don't bandage the eye. When irrigating, ensure that the chemical doesn't wash into the other eye. Use sterile eye solution, if not, use water. So, ibig sabihin yan, when the affected eye is the right eye, make sure that the head is tilted to the right and then run the water, okay, or the sterile eye solution. UV burn in water in snow sports, remember the reflection is twice, no? One directly from the sun, and the other one would be a reflection either from the snow or the water. So strong base chemical can be coming from lime, cement, and plaster. Strong acid chemicals can be happening from battery acid coming from. Mild acid or base can be from pool chlorine, bleach, and gasoline. So kung ano man yung naging burn na nangyari, these are the things that possible sources of the burns that can happen. And pool chlorine, edi mga swimmers, no, and bleaches, gasoline could be from those who are involved in cars, racing, whatever it is, So this can happen, Parang may natandaan ako naging pasyente sa clinic, mekaniko siya. So nag-aayos siya ng sasakyan and then parang nagkaroon ng battery leakage yata yung sa sasakyan. So parang gano'n, parang aksidente. So he was referred at that time nun sa clinic or was a patient and then that's the history. So hindi lang athletes, 'di ba? Yung mga ibang taong involved din pagdating diyan sa mga chemicals na 'yan. Sige, saglit lang tumunog lang. Okay, moving on. Saan tayo? How about What about specific eye injuries? Specific eye and facial injuries. So now we go to the different parts of our the face. So we have facial fracture. If a head and a face fracture is suspected, athlete is removed from the sports immediately, called compress to control pain and swelling. So hindi natin alam kung ano nangyari sa kanya during the game. So syempre, tanggalin yan sa game, hindi pwedeng maglaro. At lagyan ng cold compress to control pain and swelling. And of course, a medical doctor for referral. Then it can be also about nasal fractures. So nose is the most frequently fractured facial bone occurring either from a lateral or an anteriorly directed force. Parang di maapekto ng Pinoy dito no? Hindi matangos ilong natin Pero they are the most frequently fractured facial bone. No? Pwedeng lateral from the side anteriorly, meaning from the front. No? Pwede yan sa basketball, pwede yan sa boxing, di ba? No? An errant elbow during a basketball rebound or a punch thrown during a basketball match can cause this. Alam ko may picture ako. Saglit lang. Hanapin natin. Yan, ito yung example lalo ng basketball. Sige nga, sabihin nyo nga sa akin, from the picture, where do you think could be the possible, injury?
Elbow to the eye po, Dok.
Yes, so yung number 43, di ba, no? Pagka nagkamali ng tingin niyang walang number, yung white guy na yan, possible yun, Tapos, ano pang ibang pwede kaya na injury dyan, no? Medyo malayo naman, pero yung sinasabi ng mga fingers, di ba, no? Mga nails, pagka nagkalapitan na. So, very good, yes. That's one. An errant elbow. Okay. How about orbital fractures? So dito yung kanina pinag-usapan natin, no, bones natin. So classified either as internal, the orbital wall, or the external, which is the orbital rim, of which the inferior rim fractures are the most common. When the baseball strikes the eyelid deforms, and a subsequent increase in the intraorbital pressure may occur as a blowout fracture, can entrap the inferior rectus muscle, preventing concentric gaze and resulting in double vision. So ito yung possible na pwedeng mangyari, no? Kapag tinamaan sila ng bola, tapos nagkaroon sila ng baga masyadong impact, tapos may maipit na muscles natin, no? So magkakaroon ng double vision. Bakit? Kasi pag pinatingin mo siya, hindi magko-coordinate yung kanyang mga muscles. So kung saan mapupunta yung mata. Kung saan napunta yung mata, yung left and right, hindi coordinated yung movement, so magkakaroon ng non-retinal correspondence, no? Yung stimulation sa retina. Therefore, the patient can see double. No? So, yun yung nangyayari doon. Athlete reports pain alongside eye movement. There is hyphema, swelling, ipsilateral cheek numbness, protruding or sunken eye, vertical dystopia, and periorbital hematoma. So these are the things that can happen, no, to the athlete. So very important that uh, kumbaga talagang paano ba yan? Ingat. Hindi ko naman sasabihin na sabi mo, wag na maglaro ng ng game ba? 'Di ba no? So talagang ah, intense kasi yung pwedeng mangyari no? Um, na injury. Pero syempre, ah, patuloy maglalaro pa din. Ayan. Teka lang. Tama ba ako? Yes. Ito yung sinasabi na blowout fracture, no? Na possible, no? Na pag tumama yung bola, plant trauma, sobra ng force, so magkakaroon um, ng fracture, so pwedeng magkaroon ng tawag dito ng um, parang mechanically hindi maka-move yung muscles mo. So hindi nakatrap siya. So walang movement. No, pag pinag-follow mo yung eyes niya, hindi makaka-follow yung isa niyang eye. So something like that. So magkakaroon ng yun na yung sign mo, no, na medyo malala yung kanyang naging injury. Ayan, sa real life na picture, tinamaan ng bola, eksakto. So yan, blowout fracture can happen from that. About for our zygomatic fractures naman. So usually occurs from a powerful force directed at the cheek or from a fall. So madaming beses, 'di ba, sa isang sports pwede tayong tumumba, lalaro ka, lalakad ka, tatakbo ka, pwedeng you might suffer from a fall. So it can happen a fracture on your zygomatic bone. So signs include epistaxis, periorbital ecchymosis, cheek numbness, enophthalmos, restriction in upper gaze and diplopia, subconjunctival hemorrhage, a depressed cheekbone, and ito yung word siguro alam mo na affected ng zygomatic bones mo kapag hindi mo ma-open ang iyong mouth. 'Di ba? So, ibig sabihin, most likely, zygomatic bone mo yung iyong merong fracture. About frontal bone fractures can occur from a severe blow to the supraorbital region during two heads colliding in soccer match. So pag frontal bone soccer match naman, ito yung mga possible na fracture na mangyari. Frontal bone yan. Kanina sino ba nagbanggit niyan? Frontal bone. So a visible or palpable depression superior to the frontal sinus should cue as a possible fracture. So alam mo yan, pagka nagkaroon ka ng depression yan sa frontal part ng iyong face. No? Eye trauma. Blunt trauma can result in a minor to severe injuries. Athletes most often at risk play collision team sports or sports involving projectiles moving at high velocities. May mga game, 'di ba, yung may mga pellets yung nagbabarilan. Yan, medyo delikado kaya talagang kailangan may gear kasi malakas yung tama ng bola. We were able to play that. Ay, hindi ako pala naglaro. Ayoko. Pero nanood lang ako sa saan bang lugar yan? Pupunta dun sa Marilaki. So, meron dong sports na ganyan na pwedeng nag barilan, something like that. So, very dangerous. So, you should have your proper gear. Okay. About corneal injuries, sabi natin kanina, di ba? Corneal abrasion. So, common signs of abraded cornea, including watering of the eye, pain, and photophobia. Report of pain with each blink. Less common alkali from chalk line markings. Eye should be irrigated with sterile saline for at least 20 minutes. Hyphema naman is a collection of blood within the anterior chamber of the eye caused by a tear of the iris, the stroma, or ciliary body. So kapag meron ka nakita na collection of blood with the anterior, may picture ako niyan. Continued bleeding may lead to uncontrollable glaucoma. So hindi pwedeng magkaroon ng collection of blood within the anterior chamber, 'di ba? Which is might be a cause of the tear in the iris trauma. Kasi may iba ang pressure ng mata and it could lead to glaucoma. So this one is a sample of the hyphema. So kapag kaganyan, alam mo na meron kang possible na tear saan daw? Sa iris mo, sa stroma mo, or the ciliary body. Okay. Rupture of the globe, blood trauma by a racquetball can create pressure intense enough to rupture the globe. So athlete complains of diplopia, decreased visual acuity, and intense pain, leakage around orbit, and irregular pupil. So remember din yan, when we have tawag dito, observation of your pupil, no, pag nagche-check ka, pwedeng makakita ka ng irregularly shaped na pupil, which should be round and oval. Pero ito yun, possible na nagkaroon siya ng aksidente at naging irregular na yung pupils shape niya. Others can be retinal injury. Peripheral hemorrhaging will likely be asymptomatic, while central causes blurred vision. So kung retinal injury, kung peripheral, medyo hindi mo siya easily detected kasi. Pero pag central retina yung iyong nangyari na nagkaroon ng injury, definitely there will be blurred vision because of the macula. Okay? Conjunctivitis, so other specific eye injuries that can happen, because of dirt, contact uh, a contact lens, ano ba tawag doon? Unhygienic yung word ko. So, hindi malinis. So, it can cause conjunctivitis, May lead to inflammation. So, report of pain, swelling of eyelid, tearing, some discharge, photophobia, and possibly altered vision. Can be viral, bacterial, chemical, or allergies. So, alam naman natin na yan ang possible cause ng conjunctivitis. So, we have to interview our patient as to what happened, bakit nagkaroon siya ng inflamed na mata or redness. Lens dislocation, a sign is quivering iris when the athlete moves the eye. So, you can possibly have an impression of lens dislocation when there is makita mo yung iris niya, observe mo, it is shaking, quivering, so upon movement of the eye. So possible yun. So this one is conjunctivitis picture. So redness, can be due to allergy, can be to viral, bacterial. So it depends, what is the cause. Then there'll be different signs. Usually pag bacterial, may mga pus, di ba? Kapag ka-allergy naman, teary-teary, no? Ayan, but the redness is there. Okay, that's the end of the slide, the lecture on sports vision, eye injury. We'll go now to the, I think the last one. Saglit lang na. Okay, we're done with eye injuries in sports, and the next module is on visual performance and enhancements in sports. So I'll be reviewing to us. I have a PowerPoint for this, as we're going to review and understand what are the different visual skills demands that we have been learning already in our laboratory activities. So this would form part of our lecture for additional information. So, saan na siya? Here. See. Okay, so visual sports performance training. Okay, after you have assessed your patient, you have screened your patient. No, it's time. It's time now to enhance. Okay, or to improve those visual skills. And what are these visual skills? Okay, they are the following. Number one, visual skills evaluation. Testing current or baseline sports visual skills using a number of scientifically designed exercises and measurements to map visual strengths. Siyempre, kasama din ang deficiencies to focus the training where needed most. So when you're doing your evaluation, you're able to assess your patient, you're able to map out what are her strengths or weaknesses, and then you're able to make a program for that particular sports and give a very good training. No? The evaluation tool allows to measure the speed and efficiency of eye movements, depth perception, recognition, tracking ability, as well as reaction time and accuracy of responses. So these are the things that we are measuring with our patient. Na remember nyo naman siguro yung mga activities natin, tama? Diba, no? We want to know yung reaction time niya, yung kanyang depth, 'di ba, no, yung kanyang pag-track, no, ng mga ng objects, ano, or pag-shift ng focus from far to near. So those are the things that you need to have and or evaluate. Okay. First is the static visual acuity. So the ability to see a non-moving target at a fixed distance. Available charts are your standard Snellen, your Bailey-Lovie, Logmar, Landau-C. So it says there that degraded static visual acuity can have detrimental effect on many other aspects of the visual performance, such as your dynamic visual acuity, your depth perception, and accommodative accuracy. So it's really very important that the person is seeing clearly. Okay? So, sana 2020, iba 2015, but it's not always like that. So some athletes, as we have learned, do suffer from errors of refraction. But it's just for us to know that sometimes it could have a degrading effect, ano, or tawag dito, it can affect. many other performance of the athletes. How about dynamic visual acuity? It is the ability to resolve detail where relative movement exists between the observer and the test object. Stimulus parameters affecting DVA are target luminance, angular velocity, and time exposure of target. So, di ba, syempre, ganong kalinaw or ganong ma-sharp yung iyong target na nakita or yung light ano nito na meron, no? And then saan nanggagaling? No? Angular velocity. Remember yung ating chest pass, overhead pass, and then the triple pass na sa baba. So those are the things that can affect your dynamic visual acuity. And other could be the time exposure of target, how fast the target is moving, no? When the subject is when the object is moving too fast, of course you're not able to see almost the target, di ba, no? Parang si flash lang. Yeah, because he moves so fast, he runs so fast, so parang hindi na siya nakikita. Human attributes affecting DVA are retina, peripheral awareness, oculomotor abilities, and psychological functions affecting visual information interpretation. So, if there are also factors that can contribute to your dynamic visual acuity, which are inherent to the patient or the athlete, and that is his retina, okay, his muscles, okay. So, this would have an effect on how he is going to interpret the things that he is seeing when he's already on the ground playing his game. Okay, so these are the different charts that we can use in our dynamic and visual acuity. Okay, how about contrast sensitivity? For section A, hindi pa kami nakagawa niyan. But your contrast measures the visual system's ability to process spatial or temporal information about objects and their background under varying lighting conditions. A measure of your contrast sensitivity function should be performed with best optical correction in place to assess any change in the CSF produced by that correction and with any performance tints used during sports participation. So remember natin, di ba, inaral natin yung mga tints. So sometimes it could affect the contrast sensitivity. So dapat din, pag mag-check ka o magpe-prescribe ka ng tints, you measure once more and again or evaluate the contrast sensitivity function of your patient. So para at least alam mo na, ano ba, naapektuhan ba o mas na-enhance or that one. This one you have to use and to re-evaluate. About the refractive status. So the incidence of EOR and visual symptoms found by Beckerman and Kitzeman is similar to that found in the general population. Ibig lang sabihin, hindi lang kumuatleta ay walang error of refraction. So they did a study on that. In contrast study, athletes with significantly above average visual acuity demonstrate corneal free of high order aberration. So nabanggit ko sa inyo yung high order aberration, di ba? So merong pag-aaral na kapag ka above average ang visual acuity ng isang atleta, pag tinignan mo yung cornea niya, it is free of the high order of aberration. Kumbaga, napakaganda ng kanyang curvature, ng kanyang surface, and it's so even, di ba, no? So that the visual acuity of the patient is even above the average. Let's say more than 20/20 pa siya. So, yeah. The eye-hand foot preference, okay? So, Giovanni Battista della Porta in 1593 first described the phenomenon of ocular dominance. Since then, this relationship with performance has been activated. Dominance is defined as any sort of physiologic preeminence, priority, or preference by one member of any bilateral pair of structures in the body when performing various tasks. Ano may mga bilateral pairs ng body natin? We have our two ears, two eyes, two hands, 'di ba? Two feet. So, pag kumikilos tayo, ano yung mga ano yung may mas preeminence or mas parang ang tawag doon, dominance 'Di ba? Like sino right-handed dito, sino left-handed, 'di ba, no? You can stand better with your left leg or with your right leg, 'di ba? You can see better in one eye, better in right eye, or you can hear better in left ear, something like that. So there is that the preference of your bilateral from your bilateral pairs that is happening, and this has been found to have impact on the games that we are playing. For example, this eye hand uh, food preference would be important in sighting sports such as shooting. So it is said that 40 milliseconds ba to, faster than the info from non-dominant eye. So kung ang mata mo ay right eye dominant ka, mas mabilis yung nakikita mo, mas mabilis yan kaysa sa left eye mo. So nagkaroon siya pa. So sa sighting sports, 'di ba kapag shooting, 'di ba isa lang namang mata gagamitin mo sa shooting para susuot mo yung mata mo dun sa pinaka ano ba yon, yung target na yon, so that you can pinpoint your yung focus mo pala para dun sa target makikita mo. So paano kung ikaw ay ano ah, right eye ang iyong dominant eye pero left-handed ka, parang gano'n. So, medyo mahirap. So, meron kang adjustment. So, yung pagiging aware ng atleta sa ganito, ay kailangan mapag-aralang maigi at kung paano 'to nakakaapekto sa kanya at kung paano din siya mag-a-adjust. So, it was kaya importante yung naging, um, na-discover ni Giovanni, no, ni Della Porta. He described the phenomenon of ocular dominance. So it plays a part in our sports. So when you get your dominant eye, this is how you can do it. You're holding a card, or you can use your finger or hands, or the not the finger, but other your rings or anything. So you have done that. About depth perception. So Wheatstone first described and demonstrated the illusion of depth by inducing retinal image disparity and the psychophysical mechanism. So in relation between depth perception abilities and athletic performance was a logical correlation to explore because many sport tasks require judgment of spatial localization. So very important that the patient has good depth perception, and as a measure of depth perception, we're able to use the what do you call that, the RANDAT or the stereoflitis. No? So um, the uh, the depth perception could happen, no, um, because of your two eyes, no, with having that image disparity, so that you're able to comprehend the things or the objects uh, more than one dimension, two dimension, three dimension. No? So you're able to do that. So we have this test to instruments to use for our depth perception. How about Vergence function? So Vergence function, strength and flexibility in Vergence function provide better stability of our visual information to athletes under excessive fatigue and psychological stress. So the measurement of vergence ranges at 6 meters may be valuable only as assessment of motor compensation ability when an athlete has a large heterophoria at 6 meters. So, importante din yan, yung mga phorias ng patient. No? That's why if you're going to have your patient already in your clinic, you need to perform also the binocular test so that you're able to know phoria, no, and how much the phoria would be affecting the game. No? So um, when you have that isophoria or exophoria, how are you seeing things? Ano, are they farther or are they nearer to you? So you are able to make a move. Okay? So, parang katulad sa fencing. Parang tingin mo, pag sa fencing, di ba, itatama mo na sa kanya. Eh pala, malayo pa pala siya. Kaya lang because you don't have that good vergence function, so you were not able to assess the distance, no, ng iyong ng iyong kalaban. So something like that. So very important that your muscles are acting in coordination talaga silang dalawa. So that you have a good vergence. You can converge your eyes, no? You for near, and then you can diverge your eyes when the object has come away is away from you. Accommodative function, correlation between rapid focusing and the visual judgment typically required in rapid action sports. So, although accommodative amplitude is a common procedure for assessing accommodative function, the task of clearing letters at a very near distance does not reproduce the visual task demand encountered in sports. The approximately zero point 0.6 second latency of the accommodative response has been suggested to preclude it as a factor in many rapid uh, reactive sports. So what's happening in accommodative function, di ba? It hindi pa din ng section A pero yan, ito yung heart chart natin, di ba, no? So your change in focus, no, your ability to see the object clearly from near to far, far to near, so that you're able to respond or react even faster. So if you have a defective accommodative function, therefore you are not able to see the object clearly, then your brain will not able to interpret clearly, and your visual information processing would be suffering. Therefore, ultimately your performance of the sports would be affected. The oculomotor function is like for the use for your saccadic eye movements, no, that the athlete is able to use. Sometimes, diba, the athlete would just be looking, parang sa basketball to na naisip ko, parang nakadiretso ka tingin ka sa kanya, pero aware ka din ng periphery mo. So your eyes can be moving from one point to another point, but still maintaining your head to be in one position. So that's a function of your oculomotor, your higher and your lower motor function, so that you're able to tawag dito, maintain a clear focus even when things are moving and dynamic, ano. Syempre pag naglalaro ka ng sports, 'di ba? Madaming movement 'yan. So you need your pursuit, your saccades, ano. So you need to follow objects, or you need to maintain clear focus. So the speed of recognition, okay, the ability to process visual information rapidly has been considered as essential element for success in fast action sports, ano. So very important that you're able to recognize, no, the object coming to you, so that you're able to respond accordingly, no. Pag nag-intern kayo, baka meron kayong ma-meet na instrument yan, tachydoscope. So, ayan. But it could measure for your recognition. So, madami din pa namang iba na sa recognition. Wayne Saccadic fixator. Ayan. Mamimit nyo naman yung mga instruments. Kaya lang sa internship nyo pa. Medyo wala pa tayo. So this one, we have this activity motor response time, okay, the visual reaction time. It's written in your laboratory manual, okay. So you're able to process the your reaction to an incoming ball, no. First, being as seen by your eyes, ano, then moving to your occipital lobe, and going back to your frontal lobe for decision, and then from your frontal lobe it now will now go to your spinal, so that you're able to move your hands, ano, your extremities, and allow you to, whether what you're going to do, are you going to throw the ball back, are you going to catch the ball, keep it, are you going to dribble it, then you're able to know your response, ano. So you're able to make that decision in split seconds. Siyempre, importante ang speed, no? We are running against speed, or time rather, when we are playing sports. Your visual motor reaction time, kung nalala niyo ito yung sa ruler, ano, and it says there that, as we have said, no, the more that you're able to see the object clearly, and that your reaction time can be faster, and then you're able to have that leeway of how you are going to respond to your patient, to the object, no? Usually the ball, no? Yan, nakakita. Wayne Sacadic Fixator Band. So, maraming ano yan, mm, maraming exercises na pwedeng magawa. Sige, mag-ano tayo ng YouTube yan. Tapos ko lang ito. Then you have your eye-hand coordination, the ability to make synchronized motor responses with the hands and the visual stimuli. Was shown to remain stable with perceived fatigue factors, was shown to diminish with artificially reduced depth perception among table tennis players. So, siguro napansin naman natin kung table tennis, importante ang eye-hand coordination. Yung, yung mata nakatingin sa table tennis ball, and then yung kamay, kung anong movement niya, ano ba to? Backhand ba, 'di ba, no? Ang kailangan niya dito short ball ba, long ball ba, 'di ba, no? So you're able to um, have that decision if you have good eye and hand coordination, then you're able to execute your strategy very well, and then of course make a winning edge, no, over your uh, competitor, kalaban, opponent. Yan. If you have eye-hand coordination, you also have your eye-body coordination. So this one is your ability to synchronize motor responses with the body to the visual stimuli. So we are able to move our body in terms of what we are seeing, make a bend, make a front bend, back bend, side bend. So these things now you're able to do this, and that you're able to make a good gameplay yan. Katulad na ng mga play ng soccer natin yan, di ba? So these are different also instruments for your eye-hand body coordination, your foot, you have this balance board, no, that you're able to use. At meron din naman, alam ko nauso to noon sa mall nakita ko noon. You're able to get a good balance if you're able to stand there, and then this is moving fast. And so this one you're able to regain a good body, um, foot and body coordination. Visual coincidence anticipation. So this visual coincidence anticipation is your ability to predict the arrival of an object or a stimulus at a designated place, and usually measure with a motor response. So it can contribute to the attempt to catch or hit an approaching ball in sports, has been shown to be independent of the visual acuity skills but heavily influenced by direct motion of in depth. So when you have anticipation, if you have a good anticipation, you would be able to know what to do. Okay, where to swing the ball, the bat like that, no, where you want to be, no, because you're anticipating that if the ball is thrown so high, what do you think? Will it be over the court already? Would it be on the right side or on the left side? So you're able to do that. And ano ba to? Last one. Diba? Peripheral awareness. Okay, the peripheral awareness. And di pa rin tapos sa section A. So we're able, this the straw and the toothpick that we use, no? So this, the peripheral awareness would be represent the entire extent of your external world that can be seen without changing in fixation. So remember, you were fixing at the line at the center of the straw, and that you're able to still place the toothpicks, no, on the end of the straw. So very important in team sports because you have to know where your teammates are. Okay. Another instrument that you can use wherein you are tawag dito, you have a light and then holding something a control, then you're going to press each time you're going to see any light that is turned on at the different ends of that rods. So may pang measure yan. Visualization and imagery, we have done this, no? So you're able to construct mental images of an object or an event that resembles the actual appearance of the object or the event itself. We said that as the mind, what the mind can conceive, the body can achieve. So this skill is used very much by different athletes, and it's a working practice among them. Okay. Not to forget, if you have this visual skills demands, not to forget, you should have also a good ocular health status. Siyempre, doon nagsisimula yun. So, what you're going to do in the clinic when you have your patient, you're going to have a complete assessment of the ocular health of your patient, and which includes evaluating of your external adnexa, your anterior segment, your pupillary responses, your intraocular pressure, your posterior segment visual field, or your ophthalmoscopy. Saglit lang ah. Wait lang. Sachi. Yes, may tumunog po. May magtatanong. May kamali lang. O may gusto magsalita. Sino yun? Wala na?
Okay na po ata, Dok.
Sino ba yung nag-ano na yun? Ba't ayaw sumagot naman? Ay, nako. Okay. These are the references that I have where I get the book, and you can also have this in the library. Okay. So, very important once more to learn the different visual skills and how you're going to evaluate your patient, and what are the different effects of these visual skills to the game that he is playing. Okay. And last one on our module, I'll just finish this. So it's about the setting up of your shared stuff instead. Okay. Setting up a practice, a sports vision practice. So at the end of everything, when you have you're decided to pursue the sports optometry field, so I have some marketing ideas as to how you can make up or make that beginning. Ano, saglit lang. I-open ko lang, hanapin ko lang. Okay. So, in developing your practice in sports optometry, the key to the sports vision development is getting the message out that you have something unique to offer. Like in any other business naman, di ba? You want to let the people know that you have something unique to offer. Internal marketing should be in place to communicate the story you want to tell. Consistency is very important factor to consider for all communication opportunities. So how do we do it? Okay, there are different sports tawag dito group, okay, that are practicing this sports visual performance and training. You know, we have the Washington National. They do sports vision training. Kelly Sotherthon, that's vision therapy for binocular
Cruise
vision.
G, PR.
Saglit lang ha.
Scuba and LA7.
Ayan. So, she is a heptathlon athlete and she has problem with her binocular vision. She has phoria. We'll have video of her. I know I have one, but I have to find it pa. And then the US Air Force Academy, they also do vision training. This one is Chris Higgins. He does sports vision training. We also have a YouTube video of that. Larry Fitzgerald also credits sports vision training and the Major League Baseball. Ayan. So before we proceed to the marketing, different marketing tools that we can use to market our practice, let's just watch some videos that I have. Okay, saglit lang po.
Hi, I'm Alexis, and I'm here with Montreal Canadian Chris Higgins. Chris just finished a visual training. Can you tell us a little bit about how that's affected your game or how that helps you?
I started working with Arnie a couple years ago, and I think it's definitely helped. I actually got laser eye surgery this summer, so I wanted to adapt to my new vision. I was pretty terrible vision before. I was like 20/70. Now I'm better than 20/20, and just trying to adapt to how I see things differently, and he's definitely helped me along.
Vision is basically the triggering mechanism that the individual has to use in order to have his muscles respond to what he sees. It is crucial in hockey. It's crucial in every single sport. The lights are going to move by themselves. If you don't get there in time, no score. The faster you go, the more points you're going to get. One of the reasons that you do this so well is that you've learned how to separate your eyes from your head. Oh, 59. Remember we talked about why you like that height?
Yeah, goal puck coming in about that height, especially when I'm stepping in front, standing in front of the Bucks, is what I'm doing on the power play.
Right, okay. So we're getting those rebounds. And okay, we're going to put the prisms on.
Making it look good for the audience right now.
These are going to be a little tight, so here we go. Now you notice you're always following that ball right into your hands. Lots of people take their eyes off the puck. These lenses are forcing you to look at the puck because the ball actually looks in a different place than it really is. Unless he follows it right into his hands, he's going to miss. All right, let's do 5 in a row without the glasses. Got to go right to my belt buckle. Wow, adjusted immediately. Usually there's an overreaction. Since things look like they were over at the side, usually it takes 3 or 4 attempts to get back to recalibrate. Recalibrates immediately. It's unbelievable. You're going to read the first letter of the line, last letter. Second letter, second from the end. We're going to work in. Okay, we're going to get our eyes moving back and forth. That's what you have to do on the ice. Go.
Yes.
Good.
H, M, E, S.
I think we've had it.
Yeah.
Want to go run a few miles now? Or? All right, what do we got here? Let's see. We have a string, and hold this under your nose. And we have 2 beads that you can see. See the 2 green beads? Yeah, so look at this bead here. How many strings do you have? 2. You have 2 strings. The reason he has 2 strings is because both eyes are working. Close one eye, see what happens. Good. Close the other eye, see what happens. Good. And with both eyes open, good. This is crucial because when you're using 2 eyes together, it tells you where things are in space and when they're going to get there. Yeah, it really helps in front of the net because you have to know exactly where that puck is. Right?
Yeah.
That's the key thing.
Definitely working with Anya. I think I see things quicker and able to react things quicker, and you know, some of the exercises that we do, you know, pretty awesome, and obviously made me sweat just working on my vision, which has a lot, I guess.
So you play on the best NHL power play unit in the league. What's it like?
Oh, it's pretty easy for me because most of the time I'm just standing in front and watching the other guys make pretty plays, and most of the time I'm on the receiving end of those kind of plays. Get on the ice with Saku Koivu, Alex Kovalev, Andrei Markov, and those guys could throw some pretty good pinpoint passes. And like I said, I just got to stand in front and get some of the dirty goals. So it's more.
My phone, my wallet, passport, and tablet.
Now, one of Britain's best medal hopes at next year's Olympics has been diagnosed with a vision problem that could affect her performance. A series of tests have shown that heptathlete Kelly Sotherton's eyes fail to work together to focus on objects. She's now undergoing a special training programme to sharpen her vision and hopefully her medal chances. Health correspondent Thomas Moore reports.
Kelly Sotherton may have an Olympic gold medal in her sights, but to win it, she'll have to train her eyes as well as her body. These high-tech tests reveal she has a defect in her vision that could affect her performance in the heptathlon. She clips hurdles, she struggles with the javelin, and it may not be just her technique.
All the things that I've had little issues with, problems with, I'm finding out why they may be occurring.
This is Kelly's first eye test in 20 years, but the experts at Johnson & Johnson's Vision Care Institute aren't just interested in whether she needs glasses.
Okay, so have a look at Dennis again.
To judge speed and distance, the eyes need to focus together on an object. It's called binocular vision, but this test shows Kelly's eyes work separately. As they're uncovered, She moves her eye and refocuses.
When Kelly's looking at an object in space, when she's trying to focus at it, her eyes are slightly divergent from that point. Her eyes are not pointing at it consistently enough. Her eyes aren't able to consistently pick a point in the distance that she can focus on. They wander in and out of focus.
But the problem can be corrected by training specific muscles in the eye. Kelly will work on an online program tailored to her needs. Optometrists are confident they can sharpen her vision within 4 months.
I could hopefully, get 100th of a second off each hurdle by just doing this training. That's a 10th, and that's quite a lot of points for me. And if I can do that in one event, then maybe high jump, long jump, throwing, it can all add points on by just doing something so simple.
50% of Olympic athletes have never had an eye test. The rest of Team GB will be offered sports vision assessments ahead of Beijing.
A tiny improvement in performance can make the difference between winning and losing. So really the stakes are much higher for elite athletes. But even for normal people, we would recommend that everybody has an eye examination, because you might not realise it, but you might not be getting the best out of your eyes.
Kelly Sotherton is now focused on Beijing. She won
So we've had Chris Higgins and Kelly Sotherton, no? Kay Chris Higgins, ano yun, una nabanggit, 2070 siya, tapos nagpa-LASIK siya. So now, better than 2020 siya. And then, he's trained, no? He's an hockey player. So yung puck, sabi nga niya, no? He has to see it in space, where it is in space. So he's been doing those trainings, that would allow his eyes to really focus and see that puck, so that he's able to make a move. And while this Kelly Sotherton naman, if you're able to observe during the time na nag-perform ng cover test sa kanya, cover and cover, ano yung nangyari sa mata niya? Pansin niyo po ba? Left eye.
Para pong exophoria, Doc.
Yes, so may exophoria siya. So yun ang problem niya, di ba? Sabi niya, ng optometrist is that she's not able to fix her eyes at the object. So she will be doing some training to improve that, and perhaps they're saying that this improvement could make an impact into her sports. So, ayan yan. And meron pa sana isa, pero mas ba tayo? Magto 2 o'clock na. Magto 2 hours na tayo. So I'll just end it there and proceed to the what's the lecture? Sports. Okay. And proceed to the different marketing strategies that we can use to put up your practice. So these are just marketing tools that I have prepared. First is brand, So in your brand, you have to really make an impact, It's your identity, diba, Saglit lang, Okay na ba? If you have a good brand that is known, so people would be able to have that word of mouth, na na promotion mo, 'di ba? Because the people has a trust and that you are competent in what you're doing. So people would say that, oh, you go to this practice, you go to this clinic, ano, so that you're able to be known, ano, in the community that you are doing a good job, ano. Then you can also have your good sample story to present, no, in which your story or your parang ano to, hashtag, no, tipong ganon na alam, you are able to give to your community what is your offering, ano. So a sample would be this one: we provide everything available in eye care to allow the athlete perform at highest level, whatever age or sport. Come to us and we will provide you the best visual acuity, eye protection, and program to improve your visual skills, which will give you advantage over the competition. Whether you are a weekend warrior or a professional athlete, new technology is available to give you the winner's edge. We are dedicated to providing you the tools to perform at your highest ability. So this sample story is like selling yourself, no, and the practice, and if you're going to analyze what are the different parts of this sample story, is that you have presented yourself, that what you are doing, what you are capable of doing, and what are the tests that you are doing, di ba, no? And like yung sinabi nga nila na ano tawag dito, they even have this allow you to have that winner's edge, no, improving your visual skills, no, giving you a program that would enhance, no, also different trainings, no? So that one you can market yourself with that, with a good brand that you have, then everything can be okay with your practice. The next one is the theme. So when it comes to theme, you need to look for somehow like what your concept is, ano, 'di ba? Parang ganun. And these are the theme examples that you can have, no? It's like correction, protection, and enhancement of athletics, sports vision correction, protection, and enhancement, sports vision for winners, seeing your way to championships, the athlete's edge, supervision, super caring. So parang part yan talaga ng marketing strategy, how you're able to make an impact to your community. And syempre kapag may mga ganyan, di ba, na mas madaling nare-recall, so mas madali ka nilang at accessible ka naman. So most likely they would go to you. What about you? I'm asking, what team would you like to have? And the third one would be a niche, no? So it's find your niche. Mean to say, what are you good at, no? So it's in sports vision, it could be the practice in itself of training, but somehow it could be also like you just want to focus your practice on selling different sports equipment, goggles like that, or the different kinds of frames like that, no? But you do not like to offer the training, no? Leave it to others. So you can, but also you can have your niche, your name on it, na saying that you want to have that a practicing sports optometrist, no? Nalala ko si ano yun, si Labby, Dr. Labby. So he's really into practicing. That's his niche already. Making a name, no? And then the logo, okay? When you have your clinic, I don't know if some of you, di ba, may mga clinic, so you have that logo. When you see the logo, like, siguro sa pagkain ko yung mas gusto na. Pag nakita ko yung letter M, edi McDonald's na. Pag nakita ko si Jollibee, Jollibee, no? Pag nakita mo ang sa sapatos naman, yung three stripes na yan, edi Adidas yan, di ba? So, in sports, you can have your, this one in sports, ano, yung NBA, kilalang Lakers, ano. So, your clinic, you can also have a logo. So maybe some of you are really thinking of putting up a clinic, and then this marketing strategy would be very good. Yeah. And these are samples of a logo that you can use or that you can see in the net. Number 5 marketing strategy that you can use or that you should have is a good quality of your service, good quality of your products, no, and not really say serving cheap ones, kumbaga parang gano'n. Siyempre alam naman natin, but that's not necessarily mean kapag mura ay mahina ang quality. So you should have that balance of quality and guarantee, or what I mean is that you should be able to really provide excellent in your training, in the materials, in your evaluation, in your assessment of your patient. Give the best. No? Number 6 is the pricing. Okay, when you have your marketing strategy to use, pricing. Okay, very competitive pricing strategy. Or you can have, ngayon, di ba, may mga promo, pero don't go off naman the standard, na below the belt naman. But the pricing strategy can keep up, can keep your practice afloat. Siyempre, kapag tama yung pricing mo, hindi ka naman sobrang mahal, hindi ka din naman sobrang mura, so nagugustuhan ka ng tao, di ba? And I know this is the last one, selection. So you should have a good selection of frames, good selection of products, even with your training, that you can, there's programming, di ba, that you're going to make to your patient. You're able to give that to your patient. So have a good product tawag dito, presentation. So you have to have quality. So it goes, the selection, it goes also with the quality. So these are the 7 marketing strategies that you can use. You have theme, logo, pricing, quality, selection, your niche, and your branding. So brand. So this would help you perhaps start if you want to have that practice be known to others, in the community. So that's what it is. So that's the end of the lecture that I have with you. Section C, I would have to dismiss you because I've done visual memory, because I need to have visual memory. You can stay if you like. We'll just play a game and tell them, oh, this is one technique that you can use. So that would be it. This will just short. Saglit lang, may pumasok na text. Papunta na raw siya. Okay. Meron akong pajabi. Okay. Saglit lang. Memory.
Doc, question po.
Yes, sige lang. Meron akong...
Doc, clarification lang po, Doc. Doon po sa may lab exercise 8 and 9, yung pong sa focus flexibility and peripheral awareness, yung pong documentation po is pictures lang po or video po dapat?
Video nga lang.
Okay po, Doc. Thank you po. Doc? Doc, last question po. Doc, di ko po kayo marinig, Doc.
Yes, what is it?
Ano po, Doc? Since video po yung ipapasa, tapos yung pinapagawa niyo po is 3 trials. Yung pong 3 trials po, i-video po or kahit isang video lang po na maganda po para sa
Isa
isang
lang
trial.
po, isa lang.
Okay po. Thank you po.
Section A, follow the link on matching so that we're able to
Hello po, Doc. Nag-Shopee po kayo.
Section A, when I speak to someone, you saw the default messages. I pasted the link for the game. You saw it already. So you be the one who look. So sorry. Well, this one is visual memory. This is a technique that you can use, but it would influence how you recall some to be able to gather together. So I'm asking you I need Section A, walang sumasagot. Tatawag na lang ako.
So, nung nagpe-play po yung naka-share screen, wala po kaming naririnig po.
Hindi, yun na lang, link na lang. Kayo yung maglalaro naman eh. Sige, I'll give you time. Bababa lang ako saglit. Magbigay ako ng job ko lang sa runner. Then you select a game that you can play. Okay? Then you present. Saglit lang. I'll be back. 4A, meron na mag-present. Sino sasagot? Sino maglalaro? For A. Ba't walang sumasagot?
Ako na lang po, Dok.
Napilitan ka ba?
Di naman po.
Well, kung ayaw ng 4A, I will end the class and I'll leave it to you. Hindi ko nagugustuhan yung ugali kasi noon mainis ako. Diba? Ang tagal kong wala sa inyo eh.
Dok, ako na lang po mag-share screen na po ako.
All right, thank you, Mr. Torio. I will ask you It seems that you have a good visual memory, but what is your technique that we can learn from you, or maybe some others would have tawag dito, have observed how you do your how you have done what you have done.
Para sa akin po, Dok, ano po, tinatandaan ko lang po muna po yung nakikita ko. Yung as much as possible po is kung ano yung nakikita ko po na same, yun po yung inuuna ko po. And then hinuhulaan ko na lang po yung iba po.
Okay. So, ibig sabihin parang hula lang sa'yo. Magaling ka lang maghula. In visual memory, there are techniques in which you are able to use so that you're able to achieve a good recall of things. Like perhaps in the things that you have seen, ayan. As I was saying, papalaki pa siya. Okay. Or kayo lang yung pwede magpalaki. Parang meron kang technique na pwedeng magamit. Okay, in recall, di ba, no? Pwede ka in terms of color, you're going to group them together. Like this one, nakita mo kasi prominent yung color. Or even what you saw nga sabi mo, di ba? And then kung pare-pareho in terms of shape, it's the same shape. Ito medyo mahirap. Itong, you can see it, right? Di ba? Kasi pare-pareho din silang may white. Pero what do you think would help you recall them together, to match them together? Anong pwede mong gamitin na clue? So, kumbaga, sa visual memory, you are using clues, diba? No? So, can you tell me what clue you can use in matching together? Yung duck, okay, color gamitin natin. Pero yung the rest of the pictures, para magkakapareho sila. Dahil meron pareho silang mga white na yan. Pero anong pwede kayang magamit mo? Yes, Miss Pascual.
Yung background colors po.
Background colors, yeah, we've used that. Aside from that, what else you think? Kasi isa light green, isa brown, no? Ano pa nakita mo? Pwede mo magamit. Yes, Karenina.
Other description po, like yung isa po may tail, yung isa wala.
Yun, pwede. Sa picture, may tail, yung isa wala. Ano pa? So, in terms of the shape or the figure, iba pa. Ano pa? Meron bang nakita? Yes, bien, Luri.
Yung size po nung animals.
Yes, the size of the animal. That's what I saw also. So very good. So kung nakita natin, there are clues or there are groupings that we are able to do so that it helps in our recalling. No? That's what I want to point out lang naman sa atin. And in visual memory, when we have a good visual memory as an athlete, you're able to use this visual skill. Sabi ko, most likely sa mga figure skaters, ginagamit nila yung visual memory because they have to remember their form, their dance, their rehearsal, and to land still on the ground na hindi sila tutumba. Diba? So they have to remember yung body movement nila, yung kanilang bend, something like that, or where they are going to position, or how fast when they spin, diba? Something like that. So it is said that visual memory is very useful, no, in figure skating. So we're able to do your visual memory, and another part of the visual memory that you can do is you can have it let the patient, when you do this activity, so this would be your assignment for take home assignment. You will be able to you get tawag dito a picture, most likely a busy picture with many details, and then you're going to ask your patient three sets of questions, and then time the person in answering it. So for example, let me have an example. Saglit lang. Kuhain ko dun sa natin. Stop sharing. Ay, mali. You can see the picture.
Yes po, Doc.
So, for example, that one, so I chose this picture. Then you're going to let your patient see the picture, look at the picture, and while the patient is looking at the picture, you tell your patient that, okay, uh, you need to look at the picture and have a good memory of it, because after some time, I'm going to ask you questions about the picture, and let's see how you can recall things or have a good memory of it. As to how long the patient is going to look at the picture, walang time limit. Okay, maliwanag pa yon, walang time limit. So, halimbawa, si Miss Diane. Diane, can you be my patient? Can you look at the picture and then tell me if you are already comfortable uh, memorizing the details of what you are seeing? Then I will ask you some questions. Claro? Diane. Are you there, Diane?
Doc Dayan Antoinette po ba?
Ay, sige. Ilan ba yan, Dayan, na sasagot sa akin? Mamili kaya ako.
Ay, dalawa po kasi yung Dayan dito po.
Ay, sige po. Hindi pa nagsalita yung Dayan. Sino kaya isang Dayan?
Ako po, Dok. Hello po, Dok.
Yes. Sige. Ano kayo? Ang tawag dito? Mag-volunteer kung sino ang sasagot sa inyong dalawa.
Ako na lang po, Dok.
Ito pala. Ayan pala itsura. Picture. Mas maayos ba? Ayan. Okay. Miss Dayan Apelido, last name. Hindi kita dito eh.
Ong po.
Again?
Ong.
Ong, Dayan. Ong. Okay, Dayan. Ong. So you look at the picture and then I'll have some questions for you. To answer. Kung komportable ka na, sabihin mo lang sa akin.
Ready na po, Dok.
Okay. What is the color of the shirt, the one wearing pants?
Pink po.
What is how many lampposts?
Mga 5 po.
What's the name of the bar?
Thunder Burger and Bar po.
No. So, yung mistake mo lang, yung girl, pink yung nasabi mo, kulay red yung suot niya na shirt or sando. Balikan natin yung picture. Yung, kaya lang present this ulit. Tingin ko red. Pero hindi pink, definitely. Parang red yung tingin ko. Okay, so, pink ba tingin mo dyan? Ako naman red.
Opo, Dok. Parang pink po.
Parang pink? Oh, how about the rest? Would you say pink? Okay, so parang naalala mo naman na hindi naman, at least hindi yung orange. So that's how you're going to do your your exercise. So you would allow. But the challenge is that one, only seconds that I gave you, that has passed when I asked you the question. So ang gawin natin, after looking at the picture, kung komportable na siya, tapos timer natin, magbagay tayo ng 3 time. Let's say, after 10 seconds, after 20 seconds, and then after 30 seconds. Okay, tsaka mo lang mag-a-ask ka ng 3 questions. Okay? Malinaw po ba? O may katanungan?
Malinaw po, Dok.
So how many pictures are you going to have? To perform the activity on visual memory.
Dok, ano pong need gawin po?
Hindi ko gusto yung tanong pagkatapos ko mag-explain at binigyan ko pa ng sample, tapos
Ay,
yun ang
sorry
tanong.
po.
Tsaka ako nagtanong, sabi nyo naintindihan nyo. So sige, sumagot yung nagsabi na naintindihan kasi nagtanong ako kung ilang pictures ang kailangan base sa sinabi kong instruction.
Dalawa po, Dok.
So mali po, hindi po dalawa. Okay, you need 3 pictures. Kasi ilang seconds yung gagawin natin, Miss Diane, Charlene?
10 seconds po per pic.
Why are you muting when you are not done yet?
10 seconds po, Dok.
Yun lang ba sinabi ko? For A, why are you like that? Do not push me to the wall for A. You will not like it.
Then 20, 30 po, Dok.
So if you have 10, 20, and 30, how many pictures would that involve?
3 po.
Correct. Okay, so you need 3 pictures so that the first picture, the patient will memorize that picture, and then after which she's comfortable with the picture already to recall, then you're going to give 3 questions, but only after waiting after 10 seconds. So you get another set of picture, then ask the patient to memorize details because you tell her after that, after 30 seconds of waiting the time, then you will give 3 sets of questions again. And then get another third picture, ask the patient to look comfortably or to know the details of the picture. And then if she's already comfortable, then you move the picture out of the scene or out of her eyes. And then you wait for 30 seconds and then you shoot your questions again. So you must be ready with your questions before you let the patient see the picture, or be ready with your materials first, okay? So what you're going to do is you're going to perform this to your patient outside, in yung mga bahay. And then you're going to upload it into your Canvas. Then in the Canvas, I need, of course, to see the pictures that you have used. And then you need also to write the different questions that you have also constructed. And if the patient is able to answer it correctly or not, you're going to mark a check or a wrong or what the answer of the patient was. Okay, so you can vary the degree of difficulty of the questions. Okay, perhaps you can also ask question like in this picture, like I can say, was there a dog on the street? Pwede kasi nag-imagination siya, di ba, na may dog. So, pero wala naman. Pero you were insinuating or you were asking if there was a dog in the street, something like that. So, the questions, you can be creative about your questions so that you're able to challenge the memory of your patient. Okay? So, is that clear? Or if you have questions.
clear po, Doc.
Okay, what you're going to do. Okay, sige, I'll expect your work. I'll be posting for your submission of this in your Canvas. So that's it for me. So thank you for staying. Goodbye, class.
Thank you po, Doc.
Thank you po,
Thank you.